As a registered nurse on an intensive care unit, the safety of my patients is my number one goal every single night that I work. The only way I can effectively keep my patients safe is working through potential communication barriers and ensuring that I have the correct information for the right patient at the right time. Without appropriate communication between all members of the healthcare team and the patient, this would be an impossible task. At the end of this speech, you will understand potential barriers to communication in the healthcare setting and the importance of overcoming them. The three biggest communication barriers in healthcare today are language barriers, health literacy barriers, and effective communication between healthcare providers. The first barrier, the language barrier, pretty much goes without saying that non-English speaking patients or limited English speaking patients are going to struggle with comprehension. Patients who struggle with English ultimately cannot communicate their medical problems as effectively, resulting in an increased time to appropriate diagnosis and treatment. According to Desiree Diaz and Lynn Achillant of Clinic Journal of Oncology Nursing on August 2013, a patient who does not know English will have a difficult time with comprehension. Patients who cannot understand English proficiently struggle with understanding the medical condition and the diagnosis, and therefore cannot make informed decisions about appropriate treatments for their specific needs. They also have a hard time understanding even the simplest instructions about how to take an antibiotic at a certain time. This leads to patients that are more likely to not be able to follow the recovery or treatment plan and can result in an increased length of stay and possible readmittance after discharge. Now that I have discussed the language barrier, let me move on to my next point, which is health literacy. Again, according to Diaz and Achillant of the Clinical Journal of Oncology Nursing in August of 2013, say that the U.S. Department of Health and Human Services defined health literacy as the degree to which individuals have the capacity to obtain, process, understand basic health information and services needed to make appropriate health decisions. In the same journal, Diaz and Achillant state that 10% of the adult population in the United States is considered to have proficient health literacy. This means that 90% of patients have no clue what healthcare providers are saying. This potential breakdown can be related to the medical terminology or just not understanding the condition. Health illiteracy has essentially the same outcome as language barriers. Patients are unable to follow their treatment regimen because they do not understand what the healthcare provider is telling them, and this almost always can result in readmittance after discharge. Now that I have discussed health literacy, let me move on to my last point, communication between providers. Bedside nurses know their patients better than anyone in the hospital. We spend more time with them, and we are able to coordinate their care between multiple disciplines. We relay information to appropriate people at the appropriate time. But with all this communication, there is always the potential for a breakdown. Nurses must be able to update the doctor in an effective manner when conditions change or a complication occurs. If not, patients could receive the wrong treatment or no treatment at all. Nurses must be able to give an adequate report to oncoming nurses that describes the situation and does not leave any important details out, proving to be a breakdown in care. The Institute for Healthcare Communication in July of 2011 reports that research conducted during a 10-year period between 1995 and 2005 has demonstrated that ineffective team communication is the root cause for nearly 60% of all medical errors during that period. More than half of medication errors, medical errors, were the result of a communication breakdown. This could be as minor as giving a Tylenol an hour early to doing the wrong surgery on the wrong patient. When people's lives and well-being is at stake, our communication should always be taken seriously. Communication should not be a reason patients receive less than excellent care. In conclusion, communication is crucial in helping patients to have the best possible outcomes without causing any unnecessary harm. The areas that are most likely to have breakdown in communication are patients that have limited proficiency with English, patients without health literacy, and communication breakdown between healthcare providers. Limited English speakers and non-health literate patients present huge barriers when communicating in the healthcare setting. Special care needs to be taken to make sure that these patients adequately understand the information presented to them. Healthcare providers must be very sensitive to the information shared to make sure that the most accurate information is getting to the right person at the right time and nothing is left out. Communication is an area that is often overlooked in a healthcare setting, but is most certainly should be considered the most important area to focus improvement for better patient outcomes. Patricia Yoder Wise, in Leading, Managing, and Nursing in 2015 proclaims, effective communication is critical for success. I believe there has never been a more accurate statement.